This video is only for educational purposes. No any clinical treatment shall rely solely on the basis of knowledge from this video. More than happy for the gaps to be fulfilled with correction for mistakes and laggings.
Okay, hello guys. Today let's discuss about the TNM classification of lung cancer and followed by the staging on the basis of this. But today we'll only focus on the TNM classification, and on the TNM classification we'll only focus on the tumor size, as this denotes the nodal involvement and this involves the metastasis. So many questions are asked in the NSAT, EMS exams and C or any exams after the PG about the tumor size. So let's focus upon the T. So while starting with the T, we'll start on the T1, T2, T3, T4. And beside this, there is something called T0, which means no nodal involvement. But there is also some miscellaneous tumor size terms like TX and TIS, which means carcinoma in situ. And TX here means tumor is seen in the sputum or in the bronchial washings, but that is not able to be assessed in imaging or bronchoscopy. So they are the tumor present on the okay. So let's write this in the different with the different ink so that it becomes easy for us to know what I am trying to say and which side I am talking about. So TX means that the tumor is seen positive in the sputum or bronchial washings, but this is negative in case of imaging, seen in imaging. So TX and TS means carcinoma in C2. So for the T and TNA means there is nothing, no evidence of the tumor means T0. So for the T1, T2, T3, T4, we'll go in the descending order. For the T1, we'll have 3 subtypes. Then we'll go 1 subtypes. Then only 1 subtype. Then only 1 subtype. 1 subtype means T3 itself, and for the T4, T4 itself. So for the T1, we have T1A, T1B, T1C. For the descending order, okay. For T1 there are 3, for T2 there are 2, for T3 there are only 1, and for the T4 there is only 1 subtype. T2A, T2B, and here T3 only 1 subtype, T4 only 1 subtype. And it is very important to know the size of this tumor. So we must, and there is very easy formula: less than or equals to 1, less than or equals to 2, less than or equals to 3, less than or equals to 4, less than or equals to 5, and here not less than or equals to 6 but less than or equals to 7, less than or equals to 7. So this is something that does not follow this rule, and it makes it little bit of difficult to understand, but still we can understand. We can make it easy to understand by making it in the range like less than 1, less than or equals to 2, less than or equals to 3, and here less than or equals to 2 means here the 0.5 mm doesn't lies in the 2-1b, okay, because it lies in the T1. So less than or equals to 1, less than or equals to 2, less than or equals to 3. Here it means it is like from 0 to 1, it is like from 1 to 2, it is like from 2 to 3, okay, 2 to 3. So in this way. And here it means more than or equals to 7. Here it's more than 7. And here there is also some involvements of the organs to make it more diagnostic, and here we'll discuss about this. There is nothing to be engaged with the T1A, T1B, T1C. There is only we'll be seeing for the size, and for the 2, 3 and 4 we'll see the organ involved by this tumor size. So this will involve bronchial hilum, visceral pleura up to the visceral pleura, and sometimes causing atelectasis. While it involves up to the visceral pleura, it involves up to the chest wall, and also it involves into the bronchial hilum, it involves into pericardium and phrenic nerve. And here the 2 nodes are seen in the same lobe, 2 satellite nodes in same lobes. While in the 4 it is more than 7 centimeters. It will be involving so many things, so many invasion will be seen of the mediastinum, of the mediastinum and the diaphragm. Diaphragm, mediastinum, and their organs like heart, esophagus, trachea, and blood vessels, great blood vessels, and nerves like recurrent laryngeal nerve, carina, many things. Carina, recurrent laryngeal nerve, great blood vessels. So these are the things that is to be known, but mostly we must focus on the side. So less than or equals to 1 centimeter, less than or equals to 2 centimeter, less than centimeter, less than or equals to 4 centimeter, less than or equals to 5 centimeter, less than or equals to centimeter. So less. So among the TNM classification of the lung cancer, the tumor size is very important, and to know the tumor size, this can be a very easy pattern to know the size. So, and the questions in the exam may be asked like, according to the TNM staging, a patient with lung cancer of size 2.5 centimeter is staged as 1A, 1B, 1C, T4, or T1A, T2B. So if that is 2.5, 2.5 will lie in here as less than 3, more than 2 to 3 centimeters. So 2.5 centimeter will lie over here, so that will end up to 1. See, if the tumor size is 2 centimeter, that will be created as the tumor size T1C. So this can be a way to make it easy to understand. Okay, thank you.